We're going to do a group mock today. We're going to do an abuse scenario, an important topic. These kind of things in the exam, it's really important to focus on, because you always want to think what's the worst that could happen in any station, because we're trying to demonstrate that we're safe doctors in the exam environment, right? And so when you're doing that, you need to have a really low index for commenting on certain things. We always talk about red flags and safety netting, but another thing to bear in mind as well, because red flags and safety netting is to save the patient, right? So to make sure the patient doesn't die or something bad doesn't happen to the patient. But you also need to save yourself as well to make sure nothing happens to you. And so what you need to do is you need things like documentation, which, no one ever mentions, okay? You have to talk about these things in an exam, yeah? The importance of these things, but for some reason, it isn't within the PLAB sphere. People aren't talking about this. And so this certainly is one topic where you must mention documentation, documenting the discussion that you've had, documenting your examination findings if you've done an examination, possibly taking photographs as well, if there's some injuries, a detailed, accurate record of that, and any actions that you've taken. This is very important. You must mention this in the exam, but people aren't doing that. People do mention senior review, which is good. So senior review and documentation, I want you to add that as well. Get into the habit of adding that to any complex cases like this, any clinically unstable patient in Sim Man. I would say learning disabilities as well. But yeah, so senior review and document as well. So that's really important for exams. So we must focus on the important things, not only to save the patient, but to save us, okay? Because if we don't document, then we're in trouble. Yeah. And so in this case, in an abuse scenario, what do you think would be the red flags and safety netting to save the patient? And what do you think that the things that would be to save you are? I think we've touched on half of it. You can all hear me and see me. Yes, exit plan. Yes, and it's all often missed. Yeah, so we have a volunteer today. If he mustn't forget to do an exit plan, an emergency exit plan, because we're thinking, what's the worst that can happen? Well, the worst that can happen if if it's an abuse scenario is that they get killed. The victim gets killed. What do you think the highest risk point during the course of an abusive relationship is for the risk of death? Would you say it's at the beginning, the middle, or the end of the relationship? Or after the relationship? Yes, when leaving them. Yes. So that period at the end and afterwards as well, the highest risk times. Okay, so be very careful about giving advice about leaving them without putting safety precautions in place beforehand, because you could make things worse. Yes, so that's safety netting, right? Red flags as well, right? So physical and psychological ones. You need to bear those in mind. So there is a lot of overlap with psychiatry stations here. So in some cases, you will need to ask suicidal thoughts. As a general rule, guys, for PLAB 2 exam, you must really ask suicidal thoughts in every psychiatry station. Even if it's PMS, you should ask it. Yeah, she's a bit emotional before her period. Still, I'm just going to ask suicidal thoughts. Why? Well, because it's an exam, and the purpose of an exam is to assess your safety, right? So you need to lean towards, including these things, get into the habit. It's good exam technique, and also the physical stuff as well, obviously. Sorry, ask what voice got interrupted. Yeah, we're talking about suicidal thoughts. You must ask it in all psychiatry stations and in certain domestic abuse scenarios. You need to ask suicidal thoughts, because people, when they think of suicidal thoughts, they might think about it in terms of depression and psychosis, things like that. But generally speaking, any psychiatry station, you should be asking it in an exam. It's very, so it's very simple. Psychiatry station, ask it. I don't care if he's just had a bit of insomnia for a couple of weeks. You should ask suicidal thoughts. But yeah, domestic abuse as well, like how are you coping, and then you can transition from there into suicidal thoughts. Yeah, so we're doing these regular sessions. Dr. Luna, by the way, is supposed to be here today, but she is sick. She's had to leave work early. Yeah, she's not able to make it, but hopefully she'll be recovered and ready for the next session. We'll be doing these regularly. Okay, we have a volunteer. Thank you very much, Dr. Moosa, for volunteering. If you don't mind, Dr. Moosa, just because we want to assess your verbal and non-verbal communication so you can get the most out of today's session. If you don't mind turning on your camera, if it's not already turned on.
Yep.
Okay, thank you very much. You ready to start?
Yep.
Yep. No pressure at all.
A bit of pressure. Let's see how it goes. That's what we're here for.
Yeah,
So,
criteria for exactly. Yeah. If we were expecting the finished product, then you wouldn't need
yep.
to attend today's session. Yeah.
Begin.
Hello. I'm Musa, one of the doctors working at the hospital today. Can I have your name and age, please?
Yeah, my name's Mark Owen. I'm 24 years old.
Lovely to meet you, Marco. Marco, so how can I help you today?
Uh, yes, doctor. Just hurt my ankle a little bit.
Can you tell me more about that?
Yeah, sure. What would you like to know, doctor?
When did it happen?
Uh, yeah, it just happened about 3 hours ago.
3 hours ago. And when did you come to the hospital then?
Just about 20 minutes ago.
20 minutes ago. So can you please tell me where you were when it happened? Were you at home, working? Can you tell me about the incident?
Yeah, sure. Yeah, I was just at
Yep.
home.
Okay. So when you were at home, did you trip over? Can you elaborate more on that? About where were you standing and did you fall over something?
Yes, I fell.
Oh, you fell. I'm very sorry to hear. And can you tell me how you hurt yourself? It says in my notes that your ankle is hurting. Is that true? Can you point to me where the pain is?
Yeah, the pain is just here. It's kind of just on the outside of my ankle. He's pointing to the lateral malleolus.
Okay. Is there anything else with it?
Um,
Any
no,
bruising?
nothing else. No,
Okay, no
no.
swelling. Okay. So you were just at
No.
home,
Yeah, a bit of swelling.
walk
Yes, a bit of
a
swelling.
bit of swelling. Okay. So you were at home and you accidentally hit your leg with something? Can you? I'm not actually grasping what actually happened.
Yes, I fell on the floor.
Oh, you fell on the floor. Okay. Okay. Marco, so I'm looking at my notes here today, and it says that you've been to the emergency department before with quite a few injuries. Do you want to tell me more about that?
Yeah, why do you need to eat it? Yeah, it doesn't matter. It happened ages ago.
What do you mean by ages ago? Can you please it's been
Yeah, it
happening
was weeks
quite
ago.
it was weeks ago. Okay. Marco, so I'd like to first tell you that we're here to help you no matter what. And you can discuss with us whatever happens, and we're here to make sure that you're safe and that there's nothing going, and we're going to make sure that you're safe and that nothing goes wrong with you. Okay?
Right.
Yep. So
Yes.
it says in my notes that you've had a few injuries and you came and then you self-discharged. Is that right?
Yes. I had to leave because they were getting a bit nosy,
Mm-hmm.
asking me too many questions.
Okay. So can I ask you some questions as someone who cares about you and someone who's going to make sure that anything bad happens to you? Is that all right with you?
Go on then.
Okay. First of all, Marco, do you live alone at home? Does someone else live with you?
Yes, I live. Yes, I live with my partner.
You live with your partner. Okay. Can I know who your partner is? How your relationship with your partner is?
He's my partner. What do you mean?
He's your partner. What
Yeah,
kind of a
we're in a relationship. Yeah.
you're in a relationship? Okay. And is your relationship tense in any way?
What do you mean?
By that I mean, is there any kind of tension between you guys? I mean, what kind of a person is he? Is he treating you right?
Oh yes, yeah.
Yep. Has he has he harmed you in any way?
Oh no.
Okay. Marco, the thing is that we're here to help you out, and whatever is happening to you, you can always come to us, and we will make sure that nothing goes wrong with you, okay? And this is what we do. So if there's something you want to tell me, please do tell me.
Yeah.
Is there anything you want to tell me, Marco?
Yeah, the arguments, doctor. I mean the injuries, they always happen, you know, when I have arguments with my boyfriend.
Okay. And since when have you been with your boyfriend?
8 months.
8 months. And has this been recurring?
Yeah, I would say so, yeah.
I say, has and is he are you frightened of your partner?
Yeah, I would say so, yeah.
Okay. And has he harmed you in any other way? I mean, by that I mean, has usually with people who are with the in relationship with partners and who are abusive in nature, has they even sometimes have a harm them in sexual ways? Has that happened to you?
Oh no, nothing like that.
Okay, but he has harmed you physically, is that right?
Yes.
2 minutes
Yes, but he
remaining.
loves me.
Well, Marco, I'm I'm very sorry to hear that he's been doing that to you. And what we labeled this is something called abuse, which is a crime. And you should know that we're here for you. And if you need any kind of help of any sort, we will help you out. We can involve social services if you want, and they will take care of all your needs. And I forgot to ask one or two things, Marco. Is that all right if I come back to it? Are you financially dependent on him?
Yes, I am, yes, yeah.
Okay. And do you have a past medical history of anything, such as any kind of a mood? Do you have low mood or any kind of history of depression or any mental illness?
No, nothing like that.
Any other past medical history?
No. All fit well.
And how's your partner otherwise?
Just lovesick at the moment. My
Okay.
partner, yes, yeah, he's okay, yeah. He's a bit angry with me.
Okay. Okay. So Marco, as I was mentioning previously on before, I mean listening to everything you said, and the fact that you've been suffering at his hands, we're here to help you, and if you need anything, you can come to us at any time, and we will make sure that you're safe and you're provided with housing and you're provided with everything else that you need to be taken care of. And we can even involve social services who you can call if you want, but it's all up to you. But we'll be here to help you out. Thank you. Is there anything else I can do for you?
Yeah, have you got any advice for me at all? No, because the relationship is getting a bit out of hand, I must be honest.
Well,
Apart
yes.
from,
Move on
referring
to the
me
next
and
station.
housing and things, is there anything else you would advise me?
Well, Marco, if my advice would be that you should make sure that even if you're going back to him, that you have an exit plan, that if you should have your ID and your passport and everything that's essential in your hand, and you should know if there's someone you can call in case of an emergency. So that would be my advice to you. Yes.
Great.
Is there
Anything else
anything
you want
else
to say? Anything else you want to comment for this case in an exam? Just that you've saved him by the
Yep.
emergency exit plan, but now you need
Oh,
to
I
save
have to
yourself.
save myself. I'll be writing all of this down and noting it, and we'll be present, and I'll be involving my seniors in it. Yep.
Excellent. Yeah.
Yep.
Very good.
Well, that
how was
was
that?
it was pretty bad, but at least I got through it.
It's good. You know how some people say 90% of success is showing up.
Yep.
So your criteria for
Hopefully.
success is, is taking action. The outcome and how you perform has absolutely no bearing whatsoever
Yep.
today.
Hopefully.
What matters, is how you perform in the exam, right? And so that's
Yep.
very good. So I'm very, impressed that, at the early stages of your preparation, which is what this is, because your exam's quite far, quite far back. So, that you're getting stuck in and, taking action. Because when you do that on a regular basis, then all of your weaknesses will autocorrect because
Yep. Hopefully.
you get that, you got that sense that with more practice, you'll get that sense that, oh, this is dragging on a bit too long with data gathering, right? You got that
Yep.
sense. And so you're going to re-etch that neural pathway a bit harder. You say, why did I do that? I can't do that. Next time, I'm going to be more vigilant with my time. And so
Yep.
data gathering, I'm not going to stall on, specific details too long because you don't have that luxury in this exam. Very time sensitive exam, and especially when you're dealing with like such complex issues. And obviously I didn't make it easy for you because I wanted to test how you're going to extract and get him to get the disclosure. Sometimes, right, if it's done really well at the beginning, if it's done sensitively, non-judgmentally at the beginning, you ask them the right questions, they will just disclose it straight away. Sometimes they do that, but obviously it's good to practice that muscle of extracting sensitive information from patients and relatives, because that's a very, that is assessed a lot in this exam. Okay, not just in, abuse scenarios, but also in psychiatry and other scenarios as well, right? And so, so I like the way that you approached that. I thought you were adjusting really nicely to the patient. Um, I have the sense that, whether because it is a role play scenario, but you're a good actor, which helps, right? That you really cared.
Hopefully.
So that was good. Definitely, when I was a bit reluctant to disclose it at the beginning, that's good. Yeah, so the incident history was just a bit nervous at the beginning. The incident history, like the balance of open close questions. You did ask me an open question, but I think just, trying to ask open questions only at the beginning and then let him say something. If he doesn't say anything, then you can, ask one or two close questions. But I felt like it was a bit biased, like you were trying to like your agenda pushing it onto me kind of thing, but not a big deal. The main things are really just the time management. The emotions was very good, and fitting in your key themes at the end. So you need to be a bit more kind of vigilant with the timer because you do get the 2 minute bell, and here you've got much more than a 2 minute bell. You've got the actual timer there,
Yep.
which you won't have that luxury. So when you heard that 2 minute bell, you went back and asked me a few questions. Yeah, which I was that suicidal thoughts that you went back to.
Yes, so I want to ask. So I kind of structured it. So it was a presenting complaint, past medical history. I mean, history of presenting complaint was like the incident history before, during, and after, which is how it's supposed to be. Then I got a bit stuck there because I thought I would ask the past medical. I thought I'd ask psychiatry and past medical. And then I'd ask family history, and obviously I'd ask about psychosocial with it. But I
Yeah,
just messed up in a few places, and
yeah, that's fine.
my history of presenting complaint was pretty off. I thought was
Yeah,
pretty off when I was doing it. So yep.
yeah, we stalled a bit too long on that because it's not the key theme, is it? There's a hidden issue underneath. So we need to,
Yep.
we're not scripted, so we are going to explore what they're presented with always. But the way that you do it is a bit quicker. So here, this needs to be a bit quicker. We spent a lot of time here, and just get into the habit of grouping symptoms questions together to save time as well, rather than
Okay.
just ask one, wait for a response, ask one, wait for a response. Group them all together, and then he can tell you which ones are positive. Yeah,
Okay.
it's a very important
Sure.
skill that. So that in particular here, I would do that here. But you're not being scripted by acknowledging the injuries because you were given that information in the task, right? So in a lot of these other domestic abuse cases, it's the body language that gives it away. They're not making eye contact, they're looking down and stuff. Whereas in this one, it's the task, right? So the task tells you about all these things. That should raise alarm bells. So you come in with a plan already to do it quickly, analyze the ankle injury, the incident that's happened, and then quickly transition into, acknowledging the injuries, offering confidentiality, and then screening. Screening should start off general with open questions and then transition into direct questions, right? So you could, when you're screening, general screening, you can ask about how things at home, work, relationships. There are three problem areas. If someone's, if something's troubling someone, it's going to be in one of those domains, right? So we can just do a general kind of screening. And then if you get the sense that one of them is positive, then you can go into that area. So in this case, if it's at home, or in his relationships, then you can ask. So we talked about the depersonalization technique. And so you can do that as a way of extracting information. So that's just one example. So sometimes in intimate relationships where emotions are often running high, things can sometimes get a bit out of hand, and lovers can end up hurting one another, or even end up physically, emotionally, or even sexually abusing one another. Just wanted to ask you, and I wanted to check if that's anything you've ever experienced in this relationship. Yeah. So that's one way of doing it. So, it's sensitive, it's non-judgmental, and it makes it easy for him to say yes. So the finding isn't really him saying yes here. The finding is the details that come after it, because basically a lot of people would say yes to that, even if they're not, even if they're not a victim of domestic abuse, they hurt one another. Yeah. Yeah. It's quite a vague thing to say. So you need to get the details. Then you can ask him the detailed questions, like you can ask Hark, which is a nice screening tool. So if you get the sense that a lot of those are positive, then you've got enough evidence to say that this is domestic abuse. I'm suspecting this is domestic abuse.
Thank you.
Because it is just a screening tool at the end of the day. Yeah, so that was very nice. You did offer confidentiality. You acknowledged the injuries. You offered confidentiality, and then you asked me some questions. But I would do a bit more general screening first.
Okay.
Then zone in on the specific questions. Then, when you do get the positive finding, you need to delve into the details. Why? Because it's what he's presenting with. So you need to get the exact details of what's going on, because often people kind of shy away. So do make sure that you get the details of exactly. For example, one case, if he says they sexually assaulted me, like what was the extent of the sexual assault? Oral, sex, physical violence, penetration, anal, everything. You need to know the details because this is important. You're not being nosy, right? So do make sure you ask those. Don't be shy about asking them. And then I would do an examination here because he's presented with an ankle injury, right? He might have broken his ankle. So don't forget that. That's important. In this case, there are no indications for it, and so it's likely an ankle sprain. So you can just advise price. We did forget to talk about that, which I'm not too bothered about. That's not going to pass or fail you actually, with the because it is just an ankle sprain, but you need to examine them.
And should we
Yeah,
be
and so key
mentioning that
themes.
also? The ankle
Yes, you
sprain
should. Yes, yeah. He's come in with ankle sprain, so we have to address that. So we address it by obviously taking history, which you did, but also examining it, seeing if there are any indications for an ankle X-ray, that would, because it could be a fracture, but in this case there isn't. So you can advise that an X-ray is not needed, and you could advise price, but do it quickly, and then move on quickly to the real issue that you need to manage, right? Did you? Yeah, you referred me to social services, which is good. You address the emotions very good. Things like, this is not your fault. I believe you. What he did is wrong. Okay. Because sometimes people can blame themselves, and the abuser will often victim blame, right? So you need to emphasize those things, particularly if you get the sense that is vulnerable. And then I would reiterate confidentiality and explain your role, which is safety. Yeah. Primarily safety and support.
So how would I ask him that? How would I convey to him that I'm here for safety and support? Should I just say we're here for your safety and your support?
Yeah. So my role here is not to tell you what to do, but to assess your level of risk and to work with you to support you into coming to a plan, and to encourage you to make sure that that plan is as safe as possible. Yeah. And so the support that we can offer includes, and then you can offer him the referral to the local domestic support specialist services, or the social services. You can offer him police domestic violence advisors helpline, and some support groups. So there's lots of support you can offer, and also aftercare, so follow-up, safety netting, advice, and reading information, discreet reading information. So that's the kind of support that you can offer him, right?
Yeah.
So you can ask him, would you like to press charges against this man? For example, you can ask that in these kind of abuse cases. Like we said, be careful about saying you need to leave your partner and things like that. Yeah, and so what we often say with these cases, these emotion-based stations, that you need to pick up on the verbal and non-verbal cues, the patient cue. Make sure in this exam you always pick up on any cue. So did you notice anything in my body language or my tonality? I'm not a great actor, but was there
No, no,
anything that you noticed?
yes, the head down and not making, well, not making eye contact with the screen. So,
Did you sense any denial?
um,
That's what I was going for. That's the emotion I was going for. That I
yes,
was hoping
I
you'd pick
mean,
up
yeah,
on. Yeah?
yep. I mean, you kept on covering up for him that he's,
Yes.
and you're also not giving in, so not telling me what's actually happened.
Yes. So yeah, he could be that he was a bit frightened. But yeah, so like that kind of along those lines, like denying, frightened, all those kind of things are quite useful, I think. Yeah, but generally, like the more precise you can give the emotion, the better. So yeah, do learn, a nice wide range of different emotions that you can mention. Yeah, so ankle sprain, advise price, and then refer. You can explain briefly about what they will offer. That's just going to be support. So it's going to be emotional, psychological support, financial support, including accommodation. Okay, because he's reliant on it, which you did get that finding, which is good. So financial abuse as well. So you can ask Hark, but you also should be looking for controlling and coercive behavior and financial abuse. Yeah, follow up. There needs to be continuity. You need to track him and monitor him to see if there's any escalation. Because in this case, this is high risk because of the frequency of the injuries that you got in the task, right? So it's high risk. So definitely that's why things like emergency exit plans become even more. Because usually when people get killed, as a result of domestic abuse, it's not the first time. It's been a successive things that have escalated over time. And then, yes, the escape plan. So, a safe place, rehearse it, pack your bag, which you talked about. Avoid when you're in a safe place, avoid anywhere that you can't escape and avoid anywhere that has any weapons or anything that could be used as weapons. And then any backup money for travel, all those kind of things. And then for this one, so support groups, if you go to my all-in-one approach notes, you'll find the different support groups for the different cases. But for this one, you've got Broken Rainbow and you have Gallop as well. Broken Rainbow is specifically LGBT domestic abuse victims, and then Gallop is just abuse victims of any kind of abuse in LGBT. So it could be someone who's getting abused, like going to the toilets or something, identifies as a male, goes to the male toilets and gets nasty comments from men, for example. So that you could signpost that patient to Gallop. But this one, the most specific one, is Broken Rainbow. Gallop's good as well. But yeah, generally a men's advice line. What's it called? The woman's one. Yes, women's aid for the female victims. Doesn't really matter. Like victim support is a good general one, but it doesn't really matter. Obviously, naming the support groups, but it gives you a nice boost if you know them. There's no harm. It's not going to lose you marks, is it? It can only gain, but it's not very important. What is important though is saving the patient and saving yourself, right? And so saving the patient, obviously support groups is a part of that, but the most important here in this case, emergency exit plan. Yeah, so safety netting. Also, you can safety net for the Samaritans as well, so suicidal thoughts. And save yourself, which is senior and documentation. Everyone always mentions senior, but they forget documentation sometimes. So do make sure that you're going to say that I'm going to document the discussion that we've had, my findings in examination, because I did an examination because he presented with an ankle injury. Any photographs as well. Is good to take them, especially, for example, rape. You have to take photographs. And any actions that you've taken, like referrals and signposting to support groups and suicidal thoughts, all those kind of things. Asking him suicidal thoughts, advising emergency exit plan. Yeah. So yeah, time management is good start. Like I think you need to practice your structure, go through all in one approach, make sure you have 4 or 5 bullet points of I need to do this, then I need to do this, then I need to do this, then I need to do this. Practice those so that they're well ingrained. And then after that, the next stage is to focus on key themes. So key themes in data gathering, key themes in management. If you can do that, then you'll be ready for the exam. So yeah, that's a summary of the approach. So we explore the incident briefly. Then we transition by acknowledging the information that we got in the task about all of these injuries. We offer confidentiality, so it will remain confidential within the team according to the policy, but the exception being safeguarding issues, right? If anyone's at very high or significant or imminent risk to, of death or risk to a child, for example. Oh, that's one thing we forgot, by the way, is in FAMISH, in psychosocial history, you need to ask who else is at home. Is there any kids at home as well? Because a kid being present or experiencing or hearing or seeing domestic abuse is abuse in itself. Yeah. So guys, remember, domestic abuse cases, we must always ask if there's children at home. Yeah. Specifically. So anyone at home, any children at home. So follow up with a closed question. Don't just accept it as fact. They said no. Yeah, because we're double checking with the patient. They might have forgotten to mention it, and we're also demonstrating to the examiner relevance. Yeah, it's an important exam technique. For open question, follow up with relevant closed question. Yeah, so explore the course. So you can do general screening, homework, relationships. How's everything at home? How's everything at work? Any problems at work? Getting on well? How are you coping? Relationships. Are you in a relationship? How's that going? Then specific screening. So you can use HARC screening tool. And specific questions. Okay, make sure you get to the end, so don't just kind of leave it vague. Don't be shy. You need to know what the details are. And yeah, when you get to psychosocial, so we talked about home. That's something I don't want to miss. Another thing you might want to mention is about this partner, if they've got a criminal history. I don't think it's essential in this case for your risk assessment. I think that's a good question that you should ask about criminal history. Do you know of any of them having any criminal history? Do you know their name? Do you know where they live? Like if they're a rape victim or something. Yeah, ICE. So ICE can be used anywhere in the consultation, right? So for any emotion-based station, it's always good to ask ICE, I think. So I would class this as an emotion-based station, but I think obviously there's a lot of issues to manage here and to identify. So it's okay. But I would, if you can, try to fit ICE in early, perhaps after your incident history, if you can. And then examination, to remember to look at the ankle. Management key themes. So emotions, we have to thank you with me. Thank you for sharing. I believe you. What he did is not right. All these kind of empathetic statements, these are important for domestic abuse victim for them to hear. You can use Eve protocol as well. So, but do make sure you finish on a positive note. So I'm really glad that you've come today so that we can see, we can work things out. We can see what we can do to support you, to help you. Don't just finish it on, I'm really sorry what's happened to you. That's, really not nice what's happened to you. That's the second E, right? If you finish on there, it's good, to be an optimistic doctor, isn't it? Who solves problems, who helps them. And so finishing on a positive note with E protocol is always good. And then you can transition. So here's what I propose we do. Blah, 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 blah. So manage the physical injury. Quickly mention that. And then offer referral to the local domestic abuse specialist services. You can also offer to press charges against this man. Would you like to press charges against this man, or would you like me to get you in touch with the police domestic violence officers? And then importantly, save the patient and save yourself. So we're going to save the patient by following up, checking up on them. We're going to talk about an emergency exit plan. So gathering all your belongings, essential belongings together, travel documents, legal documents, financial documents, putting them in a safe place or keeping them with a safe person, not a mutual friend, because it's too complicated. Rehearsing your exit plan, rehearsing your exit place, making sure that that's somewhere where you can actually escape, and where there aren't any weapons present or anything that can be used as weapons. Collecting, some change and stuff for bus fares and things just in case you need it. All those kind of things, they're important for this case. So do make sure that you allocate time to these important topics. Reading information, but make sure it's discreet. I'll leave you some reading information. Obviously it will be discreet. And then some numbers and things like that you can write down for him. And then document, like we talked about, and senior review to save yourself. Yeah. But yeah, thank you very much, by the way, Dr. Moosa, for volunteering. I know can be difficult especially because, you know, it's early stages for you. But I think that's a good experience for you in terms of getting in the zone and, you know, starting to build momentum, because it's good to build momentum early. Don't waste this time. Don't leave it late,
Yep,
because then
that's
you'll
good.
regret it later on. Yeah.
Thank you.
Any other thought? I'm going to do a nice assessment on you now. Any other general thoughts that you've had about how that went?
Um,
Any
now that I've
ideas?
explained it, so I could have the because usually when the other cases I was practicing, they're more straightforward. This has the hidden agenda in it of abuse, so the transition is a bit hard to go from the ankle sprain to transition into the abuse stage. So I guess the screening questionnaire, how's everything at home? How's your relationship been? And everything at work, any changes? I guess that's the main linker, which will tell us what's happening.
Yeah. The biggest thing is you must start your screening early. Okay. And it's the same for psychiatry stations where they come in with present with another problem like insomnia, and then the underlying problem is depression, or they present with a problem like work troubles and the underlying problem is depression. Yeah. So or they present with, you know, vomiting but very vague, and the underlying diagnosis is bulimia nervosa. So they present with something else and there's a hidden problem that you need to transition into quickly. And so the secret for all of these cases with hidden issues is that you must transition early, because if you do not transition early, it will have a knock-on effect on everything. Yeah, because it completely, once it's positive, once your screening is positive, it will completely change the trajectory of the rest of your consultation. You were, you know, before this was an orthopedic case, right?
Yep.
And now it's an abuse case, it's a medical
Abuse.
ethics case, completely different. So you must do that early. It is a role play at the end of the day, right? So you've got to be a good actor, but do it early, otherwise you will suffer. It will have a knock-on effect. You won't have to do proper data gathering because, for example, depression, right? If someone presents with insomnia, you need to transition into asking your depression identification questions, which are low mood and anhedonia. Anhedonia,
Yep.
lack of interest in activities they'd usually find enjoyable. If one of those is just one of those is positive, do the assess the mood score, by the way. If one of those is positive, then you need to do a full depression history. So you need to have time to do a full depression history, to ask your cognitive symptoms, biological symptoms, including, most importantly, suicidal thoughts. Yeah, you need to ask those things, and you need to do psychosocial history, and perhaps ICE, which you probably won't have time for in a psychiatry station. I won't blame you if you don't. And then you got to manage the patient, right? So what do most people do? They ask it. They've spent ages doing a detailed insomnia history, and then they start screening too late. Yeah. And then, you know, they don't do a proper depression history, and they didn't get any findings because they didn't ask them, right? And so it's just a mess, right? And the secret was to correct that is to screen early. And it's the same for these cases. Yeah. You know, it's the same concept. Must screen early,
Yep.
then do a full domestic abuse history, including this, you know, complete the screening questionnaire. If it's an eating disorder case, you do the SCOFF questionnaire. Yeah, that's a screening tool. If two of them are positive, then that's suggestive of eating disorder. So you should proceed with the full eating disorders history. Yeah, role models and all that stuff. Ask all that stuff.
Just one
Yeah,
question.
so that's
After we've done we've transitioned and asked about everything, do you ask about the past medical, the allergy, and the family history and the social history?
yeah.
Diet,
Here's the
exercise,
thing,
smoking,
right?
alcohol, all of
I
that?
know it's a lot, but it's
Okay.
the way that you ask it, right? Otherwise, well, any medical problems in the past? Any mental health problems? Okay. So, you know, you on any medications at all? Very quick. You need to do that because
Okay.
you don't have the patient's notes, so you're not orientated. Because if he tells you I've got HIV or I've got, you know, like some really debilitating condition, it changes everything, right? So you have to ask it. But
Yeah.
just the way that you ask it should differ according to whether it's a key theme or it's not a key theme. So the way you ask that is different to this case where it's still important, of course. If he's got mental health problems, definitely. People who have experienced mental health problems are threefold, 3x more likely to be victims of domestic abuse.
Yeah.
And also it's, you know, like a vicious cycle as well, because you're also, if you've got mental health problems, for example, depression, you're less likely to report any abuse as well, right? So it's relevant question that you need to ask, but ask it quickly. So
Okay.
that's what I want you to do. This is why you need to focus on key themes and allocation of time. And so when you're thinking, this is why we, you know, we summarize three to four key themes in data gathering, 3 to 4 key themes in management. Does that mean we're not going to ask anything else? No, it does, but it's how you ask it, right? And how much time you allocate to them and how much details you go into them. So those 3, 4 things that you write down when you're preparing a case, when you're studying, revising, they're the things that I want you to spend time on and to delve into detail in. That's how you prepare for this exam, really, actually. The approach is you need to learn those before, right? That's the early stages. That's a prerequisite. That's not enough to pass, you know, knowing how to take a history or knowing how to do data gathering in each particular consultation type. You need to transcend above that and also focus on key themes specific to the patient in front of you.
Right. Thank you. Thank you.
But the planner does give you, which you've got. So the planner gives you a good, I'm quite comprehensive, right? So it gives you a good step-by-step kind of A to Z system, what you need to do that.
All right. Thank you.
So you need to read these, these management plans, okay? Because you need to be giving advice in line with management. And in line with management isn't just some PDF you read from 6 years ago somewhere on the internet. That's probably not going to be in line with the management, yeah? So you need to go to Nice CKS and actually read it. Nice CKS, by the way, is not going to cover you for everything because that's written for GPs. Yeah. Nice CKS, patient.info. These are all written. These are both resources written for GPs. And so if you're in a scenario where it's an admitted patient in hospital being seen by a specialist or a patient going to ED, then that's not going to be applicable. That's not the optimal way to manage or, to handle, assess and manage that patient. And so for ED patients, you should be reading RCEM learning, right? So this resource, Royal College of Emergency Medicine, that's for your ED. So that's your guide for how to assess and manage ED patients that are presenting to ED. And you're the A&E doctor assessing them and starting initial management. And so I've got this one open because I recently wrote some notes on gallbladder disease, which you should read because that's a very high yield case in the smart revision notes. Which a lot of people are managing wrong, by the way. They don't know how to differentiate between a biliary acute cholecystitis and acute cholangitis. So you need to make sure you have a very clear idea of how to assess what questions you need to ask and how you manage each of the different conditions. But basically, for management, if you've anyone with symptomatic gallstones, the treatment of choice is laparoscopic cholecystectomy, just like acute cholecystectomy. Yeah. So even if it's just biliary colic, they don't have jaundice, they don't have fever or raised inflammatory markers. It's just pain after eating fatty meals. The treatment of choice is still lab chole because it's symptomatic. On the other hand, and that's the same for for acute cholecystitis, but on the other hand, acute cholangitis, not ascending cholangitis, old term, yeah, acute cholangitis, where there is jaundice and a cholestatic picture, and so you mustn't forget to mention LFTs so that you get the finding. That's ERCP, right? So you don't need to go into details about ERCP because you won't have time. Just quickly mention it, and you can tell them it's diagnostic and therapeutic, right? And it's a camera test, procedure, surgical procedure. That's enough for that. The rest of the management, the supportive treatment and ED investigations is going to be the same. You're going to do bloods, abdominal ultrasound, and stuff like that. But I won't digress into that. That's just a case that we recently wrote up. Yeah, so abuse, obviously, we're going to cover actually in a separate session is the safeguarding abuse, because I think that warrants its own separate session. But certainly for those ones, you should need to admit the patient because they're codependent on the perpetrator. So you need to admit them and run some investigations often. Yep. Like skeletal surveys of this child and stuff like that. And you need to refer them to the local safeguarding authority. Yeah. When you're admitting, safety netting is not very important because listening for them is not a key theme. Yeah, chaperone, again, exam, you've got to mention these things, right? Always have a low index for mentioning examination, and then your mind think in the presence of a chaperone. Yeah, always put that in there. Doesn't take any extra effort to say that. Always put in senior review document if it's a complex case. Yeah, like this, like these cases we're discussing today. The forensic examinations are going to be done at the SARC. Yeah, this by specialists. You don't need to know anything about that. But you need to examine him in the presence of the chaperone so that you can take photographs and document the extent of his injuries. Because chances are in a few months' time, you're going to have to give evidence in court, or your senior will, and he'll be reading your notes that you wrote, and you're looking at your photos. So yeah, I hope I've made that clear. You know, in terms of I do go on things quite a bit sometimes, but sometimes I think it's good to hammer the point to make sure it gets across, which is make sure in the exam, right, for these cases. So here you've got an empathetic approach, Eve protocol. Make sure you're well practiced with that. Make sure you know how to extract sensitive information when people are like reluctant to disclose information. Yeah, we talked about using depersonalisation techniques. Sometimes, you know, when people are in intimate relationships, things can get out of hand. And, you know, you're kind of minimizing it a little bit so that you get the positive finding, and then later on dig deeper into details. Remember your important exam things, right? So red flag, safety netting, suicidal thoughts in this case, and safe emergency exit plan. Because what's going to happen in your exam is you're going to have 1 minute left for management because you spent too long in data gathering, because you were exploring the presenting complaint too long about, you know, the position of the pain of the ankle or whatever. And then you're going to get 1 minute in your management, and you need to have these things deeply ingrained in your brain. Documents in your because then you can still pass the station with like 1 minute left in your management, or you just get pulled along past, right? So it will save you. Yeah, yeah. I mean, he might be reluctant to go to SARC. Yeah, that's fine. It's up to him at the end of the day. You just need to offer, because in the guidance they always say offer, right? But you know, candidates or doctors always say, we will give you this, we will do this, we will do that. No. So if that is something you are saying, I would remove those kind of phrases from your lexicon. Okay, if you do have those deeply ingrained, make sure they're not. So you remove them. So what are the alternative ways of doing it then, or you know, offering treatment? How do we offer treatment? Is that something you think you benefit from? Is that something you'd like to give a try? Our guidance recommends, in your case, treatment called a beta blocker, a type of beta blocker called propranolol. This can help, you know, minimize the effects of the symptoms. It's certainly not a cure. There is no cure, unfortunately, for this condition. However, symptoms can be managed well with medication. Is that something that you'd be interested in at all? So yeah, just make sure you're familiar with the guidance. You know, keep things simple. Don't overcomplicate things. Summarize. This is an exam, an OSCE-based exam. They're always superficial exams, right? Detail is not going to serve you. It's not going to help you here, really. Yeah. So just cover your bases, keep things superficial, summarize 3 key points here, data gathering, 3 key points, management. Don't spend too long on specific topics. You know, make sure you get adequate coverage of everything. Yeah, anything anyone else wanted to talk about? I mean, Dr. Hatch has said a few things. Anyone else want to make any comments or questions? Okay. I think we're just wrapping up now. But in terms of your marks, Dr. Moosa, you're still there, aren't you?
Yep.
I hope.
Yep. Hi.
Yeah. Yeah. So marks, I won't worry too much about at this stage, right?
Yep.
Your criteria for success is the experience and the learning and the amount of value you gain from the session. Yeah, so it was a bit lopsided, wasn't it? To have a lot of data gathering, but not much managing. And managing was kind of rushed at the end, right? But you did actually, you know, give a nice overview towards the end so that you covered your bases in a few things, right? So you could end up getting with a borderline pass, but it's probably going to be at this stage. You know, I would say a pass is like 7 is a 7 out of 12 is a comfortable pass that's not reliant on the performance of others, right? Because obviously the marks will differ according to how everyone else performs and the difficulty of the question, but in my mocks, I put 7 as the pass because you're not going to rely. You can't base your, assess yourself based on the performance of others. So 7 is a pass, right? So that you're looking to get probably 5 to 6. Yeah, like probably 5 you would get, which is pretty good. Your baseline IPS was the strongest point here. Your IPS and your empathy was very good, and that's a key theme. So that does help a lot. Just the time management just, had a knock-on effect on anything. That's the thing, right? Is, if you don't sort out the time management thing, then it affects your data gathering and it affects your management and it affects your IPS as well. Yeah. So don't be stubborn and, do keep practicing, and they will autocorrect, because you'll annoy yourself so many times. It happens. I'm I'm similar in the sense that I overrun. Often it's my natural instinct to delve into details, right? I like to be very thorough and comprehensive. When I was preparing for this exam, I had to really work on that. And so that's why I devise these things, like, or just, I don't devise them, but it's just very, keep things simple in terms of, just summarizing 3 key points and things like that, because these are techniques that I had to use, to go through the exam. Anything anyone wants to talk about in terms of, like, and just a general discussion? How's everyone getting on with their revision? Anyone panicking? Or you're all just comfortable and you're on schedule and everything's fine? Panic. Yeah. Yeah, just the things that that you need to be doing, just make sure you do them. Just be careful of avoidance behaviors, be self-aware if you're avoiding something, because often, the thing that we know most need to do is the thing that we procrastinate on the most, isn't it? It's just a natural human tendency to do that, because we're going to resist against those things because it requires more energy. So that's why coaching is good. Do make sure, guys, that you focus on important things first. Yeah, don't leave the important things to the end, and then you're rushing at the end, and you rush on things or do things quickly or miss out things that are not important. So leave those to the end. Anyway, hope you enjoyed it, guys. Take care.